As a bovine practitioner, there may be times where you're called out to participate in a difficult calving or delivery of a calf from a cow. This is also known as a dystocia. One of the most difficult things that a bovine practitioner may be faced with is to determine whether or not the calf is being delivered in an anterior presentation or a posterior presentation. In order for us to determine that, because we cannot see the calf, it's mostly located pretty far into the cow, into the uterus, we may actually have to rely on the use of flexion of joints to determine whether we have a front limb or a hind limb. So there are two different philosophies out there to determine whether or not you're dealing with a front limb or a hind limb, and it relates to the number of joints that flex in the same direction. Some people believe that if you use two main joints, let's say the fetlock and the carpus for the front leg, they flex in the same direction, so that would be two joints, versus the hind limb, where if you use the fetlock and the hock, they flex in opposite directions, those two joints. Some people may actually use the three-joint flexion, and I'm going to demonstrate the three-joint flexion method here to determine whether we have a front limb or a back limb. So one of the most complicated things whenever you enter the cow to determine whether you have an anterior or posterior presentation is the palpation of the point of the elbow or the point of the hock. They may seem very different anatomically, and they may actually look very different once the calf is delivered. But I guarantee you, in utero, those joints can actually look exactly or feel, or I should say palpate exactly the same. And so if you're palpating this joint, you can't just assume that you have the elbow, because it can actually palpate just like the hock. So we have to use our flexion, our joint flexion method. For the front limb, what we will do is we will take the joints from the pastern, the fetlock, and the carpus, and all three should flex in the same direction. So as you're flexing these joints, you would count. So the pastern joint, right here at the tip of the claw, you will flex ventrally, in this case. Then you get to the fetlock joint, and it flexes ventrally. And then you get to the knee, or the carpus, and it flexes eventually. So all three joints flex in the same direction for the front limb of a calf. You never really have to determine the elbow flexion for the front limb. When you get to the hind limb of the calves, using the same three flexion method, you can see if we take the tip of the toe and flex the pastern, it flexes ventrally in the same direction. If we use the next joint, the fetlock, and flex it, it flexes ventrally in the same direction. But as we work our way up the limb, we get to the hock, or the stifle, and we flex it, and you'll see it flexes in the complete opposite direction. So using the three flexion method, if we were presented a calf with a posterior presentation and you weren't sure, you could actually flex, again, the pastern in one direction, the fetlock will flex in the same direction, but the stifle will flex in the opposite direction. This is a very important step in determining whether or not you're having a calf presented in a posterior presentation or an anterior presentation, and it's invaluable. Okay. Today I'm going to demonstrate placing OB chains on the legs of the calf in order to assist in delivery of the calf from the cow. This is a OB chain that we use, and to correctly place the OB chain, you have to first create a loop, and you can do that by sliding one end of the OB chain through the larger loop in the chain and bringing it down into a small loop that you can easily place over the foot of the calf and into the proper location. So the most important thing about placing the OB chain in these calves is to place it, the first initial loop must be placed right at the mid-metacarpal area of this calf. So the first thing you'll do is hang on to the calf's leg once you have it exposed out of the vulva lips of the cow. And then you'll place the chain over the foot, the claw of the foot, and slide the chain off your hand onto the area of the metacarpal area, so that that's the proper location, and then you will gently cinch down on the chain to tighten it against the metacarpal area. If you elect to pull on the chain at this point, that would be a bad thing to do, because if you elect to pull with force on this chain only, then there's a lot of pressure applied to this area, and you could easily break the metacarpal bone of this calf. So in order to avoid that, there's a second loop that must be applied, and this loop will actually be applied distal to the fetlock, between the pastern and the fetlock. And in order to place that loop on that area, you basically will take your hand and lay it flat across the chain that's extended out of the cow, and then you'll just make a simple fold like this of the loop of the chain to create another circle or loop, and then you will actually apply that loop onto the calf's leg beyond the foot, and then you will pull down and cinch down on that loop to create a nice snug fit against that area just distal to the fetlock of the calf. At this point, you can then apply a tremendous amount of pressure on the chain, and with that, what will happen is that pressure that you're applying to the calf's leg will actually be distributed across both loops and not necessarily directly on the limb of the calf, therefore avoiding any damage to the calf. If you have a very lengthy OB chain, you can actually use one chain to place the OB chains on the feet of the calves correctly on both legs. In order to do that, you have to create another loop at the other end of the chain, and you can do that by actually holding the larger loop and then just allowing the chain to slide down through the larger loop, creating a second opening there that you would then apply to the calf's leg. So you would again identify the calf's leg that you would like to apply, pass the chain over the calf's foot, place it right at the metacarpal area, and then just gently pull down against the chain until it's nice and snug against the distal metacarpal. Again, making sure not to put a tremendous amount of force on just one chain loop on the leg, because that can cause some damage and maybe break the metacarpal bone. So again, we have to apply a second loop, and we do that by, again, placing our hand flat on the extended chain out of the cow's vulva, and then making a simple fold that creates a second loop here that you would then apply to the calf's leg just distal to the fetlock, and then just slowly slide that down and cinch that down until it's nice and snug. And with one long chain, you can actually apply the OB chains to both limbs correctly in a way that will avoid injury to the calf and allow for the person delivering the calf to apply the tremendous amount of force to remove the calf during parturition. So if we're correcting a dystocia in a cow, and we've already determined that the calf is in the correct presentation, position, and posture, and we've placed the chains on the calf's legs to help facilitate delivery of this calf, sometimes we need assistance to forcefully take this calf from the cow per vagina. And we can use assistance by using several different people to apply traction on the chain to pull the calf out. But sometimes we need more than just several people who can work each chain. So therefore, what we have available to us is a calf jack. And that's what this structure is known as. This calf jack helps to provide a lot of force to deliver a very difficult parturition in a cow, especially where there's a space-related problem. So the amount of force that it can deliver can be quite extreme and can cause a tremendous amount of problems to the cow. problems as severe tearing of the birth canal or even paralysis of the calf's hind legs. So when we choose to use the calf jack, we have to be very careful and understand how we want to make it work for us without causing any damage. The first thing we do is we put the chains in place, and then we attach the chains to a hook on the calf jack so that the hook grasps it and keeps a hold of it. And then we take the second chain and we put it on the other hook on the side. This is a dual ratchet calf jack, so for every crank that we do on the handle, we actually will pull one or the other leg, one first and then the other second. And this is very important because the largest part in diameter of the calf coming through the birth canal is the calf's shoulders. So what we want to make sure to do is pull one limb first so that we clear that shoulder through the birth canal, and then we pull the second limb through so that we don't bring both shoulders at the same site into the birth canal, because that's the largest diameter. So we want one to go first and the second shoulder to clear secondly. And this calf jack has the ability to help us guide the calf through that way. Once we hook the chains to the hooks, then what we do is we have our assistant hold the calf jack up straight and then start to crank on the calf. And you can see right away it pulls. Do it one more time. It pulls on this leg first, so if we stop there, do it one more time. Stop right there. What we're doing is extending this front leg first through the birth canal entry point where the shoulder is clearing first. And then once we finish the crank by coming back down, we pull the other leg through. And you can see as we continue to pull this calf into the birth canal, we're bringing the calf's head with the front feet, which is the exact way we want this calf to be delivered. You must always, as a very important part of correcting and delivering any calf, is to pay attention to dilation of the birth canal and plenty of lubrication. So you may actually have to do this many times as you wait for a little bit to further dilate and actually lubricate. So we will constantly be lubricating the calf's head, and even further in, we may actually go further in and lubricate the calf's shoulders at the entry of the birth canal. Once we have plenty of lubrication and dilation and we feel we're going to do no harm with the calf jack other than delivering this calf from this cow, then we can proceed forward. So initially we will keep the calf jack long pull sort of in this plane here. So we will crank one more time, up and back down. And what we will find is that once the head clears and the shoulder mass is in the birth canal, we may find it very difficult to crank. So we may need to have further dilation. To help in assisting in further dilation is we may actually take the end of this long pole and go down to the ground. And you can see down, slowly down to the ground. And you can see that actually brings a little bit more of the calf into and out of the birth canal and out of the vulva. And it also creates the normal arc that we would prefer this calf be delivered in. The calf generally comes from deep within the abdomen up over the peak of the pelvic entry and then back down out onto the ground. And that's a normal arc position. So at some point we want to make sure that our calf jack is assisting in creating that arc. Once we have that amount of tension and force on the calf, we will lift that end back up. And then we will crank a few more times. You can see the calf is being delivered. Yep, a few more times, slowly paying attention that everything's in alignment. We will keep doing that a few more times. And then if we want more assistance and leverage, we will take the end of it down and we'll get more calf you see coming out of the cow. Now we're almost finished with delivery of this calf. So we have to kind of lift up again, do a few more cranks, a few more. A few more. Yep, here comes the calf. Again, in the normal presentation, position and posture, down with the end. We'll get more calf out. Okay, lift up again. And this can be very quick now, okay? Keep going, keep going. We can rotate the calf a little bit so that our hip diameter is the lengthy part of the pelvic entry. down at the very end again, more calf comes out, up, crank a few more. We have a lot of pole here to work with. Keep going, keep going, keep going, keep going. Yep, until we catch the calf, and the calf is delivered completely out of the cow. You can drop everything down now. And then we make sure to pay attention to the calf, to make sure the calf breathes, and then also pay attention to the cow after delivery. For our cattle or our bovine, if a cow is having a difficult time having a calf, that's known as a dystocia, and we as veterinarians are often called to help assist in those situations. But for the majority of the time, cows deliver their calves without any assistance. And there are 3 separate types of arrangements that must take place in order for the cow to deliver the calf unassisted. The first arrangement would be the presentation of the calf to the birth canal. So this is the pelvis of the calf, and this is the cow, and this is the pelvic inlet. The presentation of the calf to the birth canal is important in that for an unassisted delivery, the calf must be in what we call anterior presentation, which means the front limbs, both of them, and the head are presented into the birth canal at the beginning of parturition for this cow. And that would be a normal presentation, anterior presentation. The second arrangement we talk about is the position of the calf. Position we define as the location of the calf's spinal column in relationship to the cow's spinal column. So the top of the calf head is generally how we describe this sort of position. And we prefer the position to be in the dorsal part of the calf, which is the top or the pole of the calf's head or the spinal column, in relationship to the cow's spinal column, which would be this area here above the pelvic inlet, which would be the sacrum. So we prefer the calf's position to be dorsal sacral. If the calf is presented to the calf in anterior presentation and the position is dorsal sacral, that's very normal, and the calf should be delivered unassisted. Many times the calf can be tilted off to the side, and even though it's presented in anterior presentation, the calf's dorsum, the pole of the calf's head, may actually be tilted off to the side. In that situation, we refer to this position as dorsal left iliac, being this is the left ilium of the cow. This would be dorsal left iliac position. If it's tilted off to this direction, it would be dorsal right iliac, and that's how we would describe the position. If the calf was completely upside down, so that the pole of the calf is in relationship to the bottom of the cow's pelvis, it would be referred to as dorsal pubic. So the calf's head would be completely upside down in this regard. So the pole of the calf is in direct relationship to the pelvic area, the floor of the pelvis, the pubic area, known as dorsal pubic. And that's the second arrangement that we call the position. And the third and final most important arrangement would be posture. So we would like the calf to have a very correct posture, and that correct posture would be extended front legs. So both legs are extended straight ahead with the calf's head positioned between both front legs. So whenever the calf is extended into the birth canal, we would like both front limbs to be as far straight out as possible with the calf's head positioned between both legs. And that would be the correct posture, known as an extended posture. So in order to deliver this calf correctly, without any assistance typically, the cow would need the calf to be in anterior presentation, dorsal sacral, with an extended posture. As a veterinarian practicing bovine medicine, we are typically called to very difficult situations in regard to cows delivering their calves. One particular problem that cows can have whenever they're delivering their calves is what we would refer to as the head back. So normally we would like for this head to be right positioned in front between the calf's front legs, but occasionally the head gets left behind and then the calf is forcefully pushed into the birth canal by the contractions of the uterus, but just the front limbs are palpable when you do an examination. And you find as you examine this area and do your examination, you find that there is no head positioned between the front legs, but the head is actually held back to the calf's side. It can be held to the left side or the right side of the calf. So it's retained at the neck, and generally we refer to that as a head back. One of the most important things to remember for everybody assisting cows and delivering calves is that we want the calf's head to be in the birth canal, positioned between the cow's front legs. If you do not find that that's the case, then you should never put a tremendous amount of traction on the calf to bring the calf into the birth canal without controlling the head. You yourself can actually create a head back, a very difficult type of dystocia to correct, if you continue to put a tremendous amount of traction on the legs of the calf, attempting to pull the calf into the birth canal. For cattle, this calf cannot be delivered in this type of position. It cannot come through the birth canal with its head back. That's very specific and unique for bovine and most of our large animals. They have to have a very specific presentation, position, and posture to deliver this calf. So what we're going to do is go through some very simple procedures to try to correct this malposition with the head being held back. So the first thing that must take place is after you complete your physical examination is you must make sure that you relieve pressure of the calf being pushed into the birth canal. And that will give you a chance to actually assist in correcting the head back. So the first thing you would want to do is once you enter the birth canal is repel the calf back into the uterus of the cow. So you would push back on the calf just enough to give you a little bit more room so you can investigate how things are, where the position of the calf's head is, and whether or not you're able to correct this position so that you can deliver the calf per vagina. So once the calf is repelled back, again, you probably will be working against the cow, so you kind of have to work with the cow's uterine contractions and abdominal contractions. But once you feel you have enough room to make an assessment as to what the problem is, you can find that this calf has a simple head back. And I use the word simple lightly because this may be one of the most difficult dystocias to correct. In order to correct this dystocia, you have to find a method by which to bring the calf's head back into alignment between the front legs so that it's presented in a normal presentation, position, and posture. So to do that, what we will do is actually take our most favorite arm, your working arm that works the best for you, and you will find that you need to identify something to hold on to. And in this case with the head back, most everything related to the neck of the calf is very, very slippery because of the normal lubrication of the birth canal, and the lubrication that you provide to deliver this calf normally can cause a very difficult time for you to actually hang on to anything to correct this head back. So we must proceed forward until we find something that we can hang on to. And typically what I like to hang on to, or at least identify and grasp, is either the bony orbit of the eye socket or the commissure of the mouth. You can see I'm going to have to be pretty far in this cow in order to identify that. Initially, I may not be able to identify that, and it may be very difficult to correct this head back without identifying one or two of those places. So what you can do is if you repel the calf too far, what you can do is actually have some assistance, maybe pull the calf just gently a little bit closer to you by putting traction on the limb and bringing the calf closer to you. And then what you can do is work again as it's closer to you to identify the commissure of the calf's mouth. And once you identify the commissure of the calf's mouth, like I have right here, then what you can do is actually a little bit difficult, but you're going to have to push the calf back a little bit and then change places with the calf's shoulder and with the calf's neck and head, and bringing it into its normal position. And then once it's in its normal position, then you can actually start to advance the calf back into its normal presentation, position, and posture for a complete delivery of the calf. So when we're trying to correct a head-back dystocia in a cow, there are a few very important things to remember. One is that it's maybe one of the most difficult type of dystocias to correct. If you have a simple flexion of the neck with the head not very far away from you, then those can be quite simple to correct. But many times, because of the delay in getting to the dystocia and trying to correct it, the calf has been forcefully pushed very far into the birth canal by the uterine and abdominal contractions. And what that does is that typically takes the head very, very, very far away from us. So as you can see here, as we have our student trying to correct this dystocia, they will present their arm into the birth canal, identify that it is a head back, that they have two front limbs and no head positioned where it should be. So as this student searches for the head, they may actually go in as far as they could possibly go and not be able to identify the head, only palpate the neck of this calf. In those situations where the head is so far away, it becomes one of the most difficult dystocias to correct. So in those cases, what we try to do is actually pull the calf into the birth canal a little bit closer to you, as close as we can, to give us a little bit of an advantage. And now, as our student proceeds forward, they then can identify that they have an ear, they have a pole to this calf, and maybe even a bony orbit where the eye is located. The critical thing to remember about correcting this dystocia is that you're eventually going to have to gain advantage by locating something that you can actually grasp or hang on to and stabilize the control of the head. Again, with the calf being very lubricated and the birth canal very lubricated, the two most common places that we try to identify would be the bony orbit of the eye or the commissure of the mouth in these calves with their heads back. So what will happen is, once you identify one of those 2 points, you will try to get a grip on it or a grasp of it. And then once you have your hand hooked in there, so you use your fingers to as a hook, and you identify that and you hook into the mouth of this calf, then you are pretty much in control. And then you can start to correct this malposition that you have in this situation. You're not going to damage the calf, even if it's a live delivery and the calf is still alive. You're not going to damage this calf by putting a lot of force on the commissure of the mouth, or if you elect to use the bony orbit of the eye, you can actually use it as a really nice place to hang on to without causing any damage to the eye or the calf's bony orbit or the eyelids. So what we have here is we have a nice grip on the commissure of the mouth. That gives us control of the head. And now what we must do is take the head and bring it into its normal position. This can be difficult because, just for demonstration, what you cannot do is basically swing the head all the way around like this and expect for it to land into the birth canal. It will constantly not work that way. So you have to do a couple of things. So once we have control of this head, we have to also, once we have control, we have to also push the calf back and away from that side there. And as you do that, you are trying to change places with the shoulders of this calf. And sometimes, if we stop right there, you will end up with the calf's head a bit upside down. You have to take a break right now. We have to breathe and rest and give everybody a chance to recover, because that would have taken a lot of work to correct the calf's head to this position here. Once you have the calf's head in this position, you may not use the commissure, the mouth anymore. You may actually extend your hand in and actually go over the face of the calf's head. And what we're going to try to do is just rotate now the calf's head up, sliding it along the uterus and into the birth canal, placing the calf's head between the front legs of this cow, putting it in the right presentation, posture, and position for a more normal delivery. Although we prefer the calf to be delivered, a normal delivery to take place with the calf in anterior presentation, we often have the calf presented in a posterior presentation. So when we do our examination, our initial examination, we will approach the pelvic inlet and we'll find that we see two front legs but no head. If we approach the cow before we have to do any pelvic examination and 2 feet are outside of the vulva, that can help give you an indication as to what you're dealing with just by looking at the soles of the calf's feet. If the soles of the calf's feet are facing the sky, like in this situation, you have 2 thought processes before you do your examination. One would be that you have an anterior presentation where the head of the calf, and these are front legs, is presented into the birth canal, but the calf is upside down, or possibly there's a minor uterine torsion that needs to be corrected. If the calf's hind legs are presented in, for a posterior presentation, then you will also see that the soles of the calf's feet are pointing towards the sky. So your first indication that you may have a posterior presentation is determining what direction the soles of the feet are pointing. You also should always try to figure out if you have front feet or hind feet by doing your flexions of your joints and making sure how many are flexing in the correct direction or the same direction as we described in a previous video. In this case, with no head present into the birth canal and the calf's soles pointing up towards the sky, and the flexion test shows us that we actually have a back leg, we call this posterior presentation. The calf can be delivered in this particular presentation, but it may be very difficult for the cow, and we have to do very specific procedures to avoid injuring the cow. Remember, the anterior presentation has the head positioned between the front legs, and it's this gradual expansion from the feet to the nose of the calf to the pole of the head of the calf that grows in diameter. And this normal expansion with the size of the diameter of that area expanding allows for complete dilation of the cervix and the cranial vagina. So the calf's normal presentation also assists in complete dilation of the birth canal so that we have delivery of the calf without injury to the cow. If we present it with the hind legs in a posterior presentation, we do not have the head adding diameter or size to the calf as it enters the birth canal. And you can see as we go down the calf's legs all the way to the point where we get to the calf's hips, is where we initially get a majority amount of diameter, and that's already at the point of the cervix, so there's not a gradual dilation that takes place. If we're very aggressive and we put chains on this calf and we help assist this cow by aggressively pulling this calf out without giving consideration to further dilation of the cervix and the cranial vagina, we may actually cause a tremendous amount of damage to the cow. So one of the most important things to remember about a posterior presentation delivery, although it is possible and it happens quite frequently, we as the assistants must make sure that the cow is fully dilated at the pelvic inlet and the birth canal in order to avoid any tears or injury that this force of expulsion of the calf can create. Once we put the chains in place and we do full dilation and slowly extract the calf, this calf can be delivered posteriorly without any damage to the cow. Another dystocia that we often identify in our cattle would be what we call the true breech presentation of this calf. So it's a posterior presentation, but the position is not correct in that the hind limbs are forward near the calf's head, and the only thing presented to the birth canal is the hind end or the butt of the calf entering into the birth canal. Many of these cows actually do not have strong uterine contractions or abdominal contractions because there's not a lot of bulk in the birth canal, so they're not forced to have strong abdominal contractions. And many times the first thing that the producer identifies is the tail of the calf that is exiting and is beyond the vulval lips of the cow. And so we, as practicing bovine veterinarians, if we get a call for that, we pretty much know right away, if only the tail of the calf is presented out of the vulval lips, that we're dealing with a true breech, where the butt end of the calf is in trying to enter the birth canal, but it's not able to because its size won't allow it to completely enter the birth canal. In those positions, those situations, we have to bring both hind limbs into the birth canal to deliver it in a posterior presentation method. Since we know we can deliver calves in a posterior presentation, we just need to correct the limbs and bring them forward into the birth canal. Some people may actually turn this calf completely around and deliver it in an anterior presentation, but it's not necessary since we know that a posterior presentation delivery can occur in our cattle. Another important fact that typically goes along with just the tail being presented at the vulval lips for these cows, if they have a true breech, in my experience, the majority of the time it is because there's twins involved. So there's two calves trying to be delivered, and one calf gets pushed into the birth canal first by the force of the uterus and the space of the other calf, and it gets pushed into the birth canal in an odd presentation. So my first thought actually when I approach these dystocias is that there's probably going to be two calves involved in this situation. Okay, if we have determined that we have a posterior presentation but with no legs, because the birth canal is free of legs and all you have is a tail present, then we call that a true breech presentation. We can deliver this calf, but it's going to take a lot of effort to bring both hind limbs up and into the birth canal and then deliver it through a normal posterior presentation. So the first thing that we will do is a lot of times the calf's legs, hind legs, are positioned as such you see here, with the entire leg working itself forward and ending up next to the calf's neck or head. It's that far away from you. A second thing to remember about this dystocia is that you may not have a lot of ability to repel the calf back in to give you more room, because if you repel the calf back into the uterus, you actually take away the limb and it moves further away from you. So what we have to do is work with the bulk of the calf's hind end that's presented into this pelvic inlet, and we will slide our hand in as far as we can until we locate the tibia of this calf. And then once we're there, we get a really nice grip, the thumb on the other side, 4 fingers on one side, a really nice grip like you're gripping a baseball bat. And then once we have a really nice grip, what we will do is pull this calf towards the birth canal. So that calf will work, that leg will work forward towards the birth canal, again flexing the hock as you see here. Once you do that, we will come out of the cow again. We'll take a break. That would have taken a lot of effort to do. And the calf's leg is then in position for the next set of movements that must take place to correct this. So again, we will slide our hand in, up underneath this leg if we can, off to the side, and we're going to grab a hold of this calf's metatarsal bone here. And once we grab that tarsal bone, metatarsal bone, we'll put our mini fingers over it and thumb. And then once we get in that position, then we'll pull back on that calf gently and slowly. And at the same time you're doing this, at this point, we're going to have to repel the calf's hind end. So you're going to take your other arm and you're going to slide into the birth canal and you're going to repel this calf back into the uterus, giving us a little bit more room to work. Again, just to stop here and describe, we're going to have a lot of length from the point of the hock to the tip of the toe. This length is going to be longer than the diameter of the inlet of the calf's birth canal. If we continue to pull this calf's leg into the birth canal, we will drive this hock up, and if we're not careful, the hock will actually split the uterus like this. And that is a very bad thing to happen. It could actually mean that the cow will not survive this procedure. So we will avoid pushing that hock through the cow's uterus. How do we do that? Well, once we get a good grip on the metatarsal bone and we're ready to protect our ventral pelvic area by using our other hand to guard against the claw of the calf's feet, we have to do 2 things. One is we have to drive forward, again repel the calf's leg into the cow's uterus the best that we can, and then we have to do this at a diagonal. Since that's the largest width of the cow's pelvic inlet is the diagonal, we need to take advantage of that length. So as we're pushing this calf's leg forward, dorsally, towards the hock forward, we're bringing the fetlock and the feet into the pelvic canal. So again, try not to go straight up and down like this. This will guarantee that you will tear the cow's uterus. You have to approach it at a diagonal, and then you have to try to repel the hock towards the cow's head at the same time entering the calf's foot into the pelvic inlet. Now we're going to go in after the next leg, same thing here. So we're going to slide our hand in until we get to a point of the tibia. We're going to bring that forward just as we have here. We're going to stop right when the when the hock reaches the pelvic inlet. Then we're going to repel the calf a little bit into the cow, and that gives you a chance to take your hand down and approach the metatarsal bone, getting a good grip on it, bringing that forward, repel this calf, and at the same time we're going to go under and protect. Again, we're going to try to take advantage of the diagonal, so as we're correcting this, we must pay attention to try to take the calf's hock forward towards the cow's head, and at the same time lift up on the calf's foot, protecting it into the birth canal, bringing both back legs into the birth canal. And once we're in that position, we probably haven't fully dilated the cervix just yet, so we must spend a little bit extra time fully dilating the cervix. Like with any posterior presentation, that's got to be a critical point to address. Once you finish fully dilating the cervix, you can gently pull this calf out of this cow and deliver it in a posterior presentation. Another dystocia that needs an assistance to correct would be a calf that's upside down. There's 2 reasons why a calf may be presented into the birth canal upside down. One would be that the calf itself is just upside down. The second reason would be if the cow presenting the calf has a uterine torsion. So in order to distinguish the two, for a uterine torsion, you could try distinguishing it by inserting your hand into the birth canal and into or towards the uterus at the pelvic inlet, and determining that you find that the uterine tissue or uterine body wall is actually twisted or turned over one side or the other. They can occur to the left or to the right. It makes no difference. If that's the case, then you have to possibly do a more invasive type of procedure to correct the uterine torsion. If you can't determine that the uterus is twisted per vagina, then one way that could help you is to do a rectal exam in those animals. And once you do a rectal exam and you reach beyond the pelvic inlet, you will find that the broad ligament of the cow is pulled cross midline from in the direction of the twist. So if the twist was to the left when viewing from behind the cow, we would find that the cow's left broad ligament is pulled towards the right and crossing midline. That's another way to determine that you have a uterine torsion. Again, that's going to take a different set of procedures to correct that position. Today, what we're going to discuss is the calf being upside down and presented into the birth canal. In this case, if you examine this calf, you will find that the head of the calf is there and the two front feet of the calf is there. So our presentation is the presentation we would like, which would be anterior presentation. If the legs are extended straight and the calf's head is between the two front legs, then we find in this particular dystocia that our posture is also correct. But what is not correct is the arrangement of position. So our position is wrong. And the way we determine position is the dorsum of the calf's head in relationship to the cow's spinal column. And what we find is that the dorsum or the pole of this calf is in more close relationship to the floor of the pelvis or the pubic bone. So it's in dorsal pubic position. We would prefer for the head to be in dorsal sacral position. Another helpful indicator right when you arrive at the dystocia to tell you that something is very wrong is if you only have the calf's feet outside of the cow's vulva, you will find that if the sole of the calf's feet are pointing or the surface of the sole is up and facing the sky, you generally have, if it's an anterior presentation, an up-down side calf. If you have a posterior presentation, then it's in the normal position, but it's just a posterior presentation. So in this case, because the head is present and we've determined that we have front limbs by flexing our joints, we know that even though the soles of the calf's feet are facing the sky, it's an upside down calf. In order to correct this malposition, we're going to have to basically repel most of the calf out of the birth canal and into the uterus. So a forceful repelling of the calf into the uterus. And then once we have the calf into the uterus, that gives us a chance to identify either the legs, the shoulder of the legs, or the withers of the calf, and gently try to turn the calf over so that we get the calf in the normal position. Position. The other thing that you could do is actually crisscross the calf's legs. So you could actually take the two calves' legs and just start to crisscross them and just spin them on each other until you actually rotate the calf's body over and get the calf into a more normal position for delivery. Sometimes the head may be left behind, even though you get the feet corrected in a more normal position, and then you can easily go back and get the head and bring it into the normal position for delivery in anterior presentation, dorsal sacral position.